Dr. Paul, the floor is yours.
Morning, everyone. My pleasure to welcome everyone to the signing ceremony for Health Connect Jamaica. I want to first welcome the Honorable Juliet Cuthbert-Flynn, our State Minister, Ministry of Health and Wellness. Also with us, our Permanent Secretary in the Ministry of Health and Wellness, Mr. Dunstan Ryan, very own principal, Professor Dale Weber, Vice-Chancellor and Principal of the UWI Mona campus, Mr. Jason Fraser, Country Director for USAID, welcome, sir. Dr. Geoffrey, Barrow, Director and Principal Investigator for this project, Health Connect Jamaica. And I want to welcome also any other special guests, members of the press, members of the media. We want to thank you for your attendance here this morning. This is a very special occasion. The year is already moving quickly, but we can say, I would say, Happy New Year. And this is one way for us to celebrate the beginning of 2021 in the midst of the management of the pandemic. There's always opportunities for us to bring good news and to celebrate good news. And this morning, as an academy, as a university, as the University of the West Indies, we are celebrating the core business of the academy, which is, we talk about teaching, research, and service. And I think this project brings together all of these three elements. I'm not going to say too much because we're going to hear a little bit from the individual speakers on this project. But it is a project that sits within the Faculty of Medical Sciences, our oldest faculty. We're now 7 decades plus old. And it is a project too that speaks to the heart and the vision and the strategic intent of the Faculty of Medical Sciences. We have very much, for the 7 decades that we have operated, we have sought to respond to the health needs of the population. And we did it with severe protein energy malnutrition, for example, years ago when we took on that challenge of dealing with kwashiorkor, marasmus, the dreaded, malnutrition problem. And working with the ministry, working with our partners throughout the communities, we were able to eradicate severe protein energy malnutrition, so much so that a few years ago we closed the ward where we had those patients. And it speaks to really what we call social accountability. The faculty believes that it has to be socially accountable. The work that we do must impact the needs of the population. And Health Connect Jamaica is about caring for persons with HIV and improving access. We'll hear more about it. And we feel that it fits very much within the socially accountable vision of the Faculty of Medical Sciences and by extension our university. So with that stage set, I'm going to invite our principal, Professor Dale Weber, to bring his remarks. Principal Weber.
Thank you very much, Dean Paul. The Honorable Juliet Cuthbert-Flynn, State Minister in the Ministry of Health and Wellness. Mr. Jason Fraser, Country Director, USAID. Permanent Secretaries Dunstan Bryan, Dr. Paul and Dr. Barrow, who PI on this project. Ladies and gentlemen, good morning to you all. Welcome to the University of the West Indies, which is, of course, our place to shine. And here we have an opportunity to put the university in partnership with friends and colleagues as we shine. The university has operated on a strategic plan which has access, alignment, and agility as its key words. This project creates an opportunity for all three to be achieved. Access, not just to the university, as students would like, but access to the research, access to the organization, and access to the functionality of the university are going to be achieved and continue to be achieved by this project. Alignment is an important part of the university's success and strategy, and an alignment here with the Ministry of Health and Wellness, who have always been a partner, and even more so now have become partners, demonstrates that the university continues to be at the service of the country and the region. Alignment as well with USAID as partners who have helped us many times, and we have been able to help them in the organization of different components of USAID and UWI relationships. And of course, we do this with agility, meaning rather than taking years to get things done, we're going to be doing it in a far more reactive and proactive fashion. Rather than taking a long time to get to those who need the intervention, we will be doing it through mechanisms which will allow people to have access and have treatment where they can have it in a more functional time frame. So for us, this is a relationship that is working extremely well for the institution, for the country, and for the region. To attain the goals that we have of 90-90-90, it means we'll have to work together. And that partnership will help us get to the point of making possible access to care and access to continued care, keeping people in care, and reducing that viral load as the end. For us, this is a wonderful success day, which is a continuation of a project we would have started last year, and we look forward to being able to meet every year to give you an update as to how far we've gotten. Because finally, the university prides itself in having data, having information, and being able to use those data to make the best decisions. Even if we're unable to exercise the decisions ourselves, through the partners that we have at USAID and the Ministry of Health and Wellness, we think we are perfectly placed to achieve success. I welcome you all to the UWI and look forward to this signing and the continued relationship which will help us to grow. Thank you, Chair.
Thank you, Principal Weber. The USAID is no stranger to Jamaica and indeed the campus, and they've been involved for many years in supporting important work in the health sector and in the overall development of Jamaica. It's my pleasure to now welcome and invite Mr. Jason Fraser, the Country Director of USAID, to bring his remarks.
Thank you very much, Dr. Paul, and thank you as well, Dr. Weber, Principal of the University of the West Indies, to the Honorable Juliet Cuthbert-Flynn, State Minister of the Ministry of Health and Wellness of the Government of Jamaica, Mr. Dunstan Bryan, Permanent Secretary, Ministry of Health and Wellness, Government of Jamaica, Dr. Dale Weber, and Dr. Tomlin Paul of the Faculty of Medical Sciences and President and Principal of the University of the West Indies campus, Dr. Geoffrey Barrow, Director, Health Connect Jamaica and Dean's Office, Faculty of Medical Sciences, members of the media and other distinguished guests. Thank you for joining us here today. This is a very exciting time for the university and obviously for Jamaica. We believe at USAID and also our colleagues at PEPFAR, the President Emergencies Plan for AIDS Relief, that this project will indeed make an impact on HIV interventions in this country. The United States and Jamaica are a community with many shared values and many shared interests. What affects one affects all of us. The United States has a long established investment in seeing this country, Jamaica, grow from strength to strength. And the United States Agency for International Development's core mandate in Jamaica is to partner and bring together communities to address issues of common concern. One such concern has been at the forefront is that of HIV and AIDS. However, in late 2019, another virus took center stage, and we all know what that virus is, COVID-19. The COVID-19 pandemic, since its advent, has created many challenges globally, especially within the health sector. Public health has had to grapple with meeting the needs of the population and also looking at the onslaught of this deadly and contagious novel virus. Also trying to sustain gains against all other diseases, including HIV. The Jamaican government has been no different, and USAID wants to publicly reiterate a big thank you. A thank you to the Ministry of Health and Wellness, governed in part by Permanent Secretary Bryan, for keeping HIV at the forefront while adeptly managing the health effects of COVID-19 on the nation. Despite the coronavirus, gains made are being sustained with progress towards the acceleration of HIV epidemic control in Jamaica. However, the infrastructural and human resource constraints Jamaica will require alternative healthcare service delivery models to address the healthcare needs of the population. So This partnership, the current partnership between the Ministry of Health and Wellness and the University of West Indies provides an opportunity to address these concerns in a manner that eases the burden on public facilities, while providing affordable and accessible care to people living with HIV in Jamaica. To this end, the USAID-funded Health Connect Jamaica activity aims to support the Ministry of Health and Wellness by strategically strengthening HIV prevention care and treatment services. It will do so by expanding the lens of activities already ongoing in the private sector space. All services are implemented not only in accordance with globally accepted HIV standards, they align also with the Ministry of Health's Wellness clinical guidelines for HIV management and governance. It is also crucial and critical to note that the Health Connect Jamaica is also COVID-19 ready and friendly, offering client-friendly online, socially distanced, safe options. Through an online reservation application that allows prospective clients to engage the network, HIV risk assessments can be done with scheduling appointments for services to be delivered. Recognizing not only the importance of a multi-sectoral strategy, but of good partnership in the right spaces, the Health Connect Jamaica will continue to contribute to a healthy and stable Jamaican population. We encourage those who are impacted by the HIV virus to take advantage of this opportunity, for every life is a valued life and is one to be lived to its complete potential. So on behalf of the U.S. government, on behalf of USAID, and on behalf of PEPFAR, we thank the Ministry of Health and Wellness, the University of West Indies, and all of Jamaica for the dedication and partnership with USAID on this very important matter. It is a testament to our two countries' long-standing relationship as neighbors, partners, and friends. Thank you very much.
Thank you very much, Mr. Fraser, for those encouraging words. And there is certainly, we're hearing the commitment of the U.S. government to continue investments, certainly in terms of the delivery of services in health. And this is what the Health Connect project is about. We certainly can't do it without the funding, without the support. I think working with Mr. Fraser, he has brought more than funding, but he's brought an energy and a passion for the involvement of his organization to the campus. That energy and passion is also important in the academic direction and the directorship of the project. And we've had at the helm of this project our lecturer, Dr. Geoffrey Barrow, who is a committed, very, very committed and passionate individual with respect to the care of persons living with HIV. Dr. Barrow is a lecturer in the Faculty of Medical Sciences, and he has taken on this project in a very special way. We're going to hear from him now as he brings his remarks, as he speaks about the work with Health Connect Jamaica. Dr. Barrow.
Thank you very much, Master Dr. Paul, the Honorable Juliet, Minister of State in the Ministry of Health and Wellness, Permanent Secretary, Mr. Duncan Bryan in the Ministry of Health and Wellness, Mr. Jason Fraser, Mission Director for USAID, Professor Weber, distinguished guests, ladies and gentlemen, and members of the media. We'd like to thank you for this opportunity to speak today and for the momentous occasion that I believe the signing of the MOU is with the Ministry of Health and Wellness for the services in the private sector for people living with HIV. For me, health equity is a really important component in the work that I do. So we've always tried to maintain the fact that health is a human right, and this project really does speak to that focus, whereby all members of the community should be able to have the right to access healthcare in a fashion that they see fit. Secondly, I'd like to say that the project is really focused on information technology, as pointed out by Mr. Fraser, that we have online reservation applications, we have a lot of electronic data systems that we share with the Ministry of Health, and we believe that IT is going to form a really important component in healthcare delivery in the future. The third aspect of the project that's really important is the aspect of healthcare financing. As we know, access to finances to provide healthcare in resource-limited settings is a very important feature. And the project is now in this phase where it is testing sort of a very novel way of financing healthcare and providing services for people who are unable to afford it for themselves. And lastly, I'd just like to thank all of the support from the University of the West Indies, from USAID, from the Ministry of Health and Wellness to perform this venture that I believe is going to be a very important feature of the national health landscape for Jamaica. And lastly, really to thank the team at Health Connect Jamaica. None of this would have been possible without you guys. I am merely the face of the organization, and I'd like to thank you all for the tremendous amount of work that you've had to do in order to get the project to this state. So thank you very much, and we look forward to the future of the project.
Thank you very much, Dr. Barrow. It's now my pleasure to invite the State Minister, Ministry of Health and Wellness, the Honorable Juliet Cuthbert-Flynn, to bring her remarks. Minister.
Thank you so much, Master of Ceremony. Dr. Tomlin Paul, Dean of the Faculty of Medical Science, Permanent Secretary, Minister in Health and Wellness, and Dunstan Bryan, Dr. Geoffrey Barrow, Director of Principal Investigator, Health Connect Jamaica, Mr. Jason Fraser, Mission Director, USAID, Professor Dale Weber, Principal, University of the West Indies, Mona, distinguished guests, ladies and gentlemen, members of the media, a pleasant morning to you. Again, this is really a very important morning, the signing of the Memorandum of Understanding between the Ministry of Health and Wellness and the University of the West Indies. I think this is timely, and I'm very excited about it. Good morning, everyone. The Ministry of Health and Wellness continues to lobby for support regarding national public health reform and encourage partnerships and shared interests for the cause. The implementation of public-private partnership in the public health sector remains a key strategic objective of the ministry and forms part of the government's multi-sectorial approach to controlling Jamaica's HIV/AIDS epidemic. HIV and AIDS and other STI/STDs continues to become an ongoing concern in public health globally. This joint United Nations program on HIV and AIDS, UNAIDS, found HIV prevalence in Jamaica at an estimated 1.4% in the general population, with an estimated 32,000 persons living with HIV. At the end of December 2020, almost 14% of people living with HIV were unaware of their status, which is about 4,469 persons. The current service delivery model presents challenges in optimizing prevention, treatment, care, and support services for HIV/AIDS patients. Infrastructural constraints and the lack of human resource capacity will require alternative healthcare service delivery models to address the Jamaican population healthcare needs. Jamaica recognizes these challenges and welcomes the support to not only improve service delivery, but also to meet the international supported 2030 target outlined by UNAIDS, which are 95% of people living with HIV and know their status, of course. 95% of persons diagnosed with HIV infection and receive sustained treatment, and 95% of people receiving antiretroviral treatment will achieve viral suppression, and that is really our goal for 2030. The Ministry of Health and Wellness recognizes that while Jamaica did not meet the targets set for 2020, the targets for 2030 are still attainable, and the Jamaica HIV response will continue all efforts to achieve them. One of the national HIV program's ultimate goal is to ensure all people living with HIV transition from diagnosis to viral suppression in a timely manner. One critical step in attaining this goal is to ensure all persons diagnosed with HIV are linked to care and are retained in care are on ARVs. The MOHW recognizes that persons may not opt for care within the private sector, and this collaboration this morning with HCJ will strengthen the overall HIV response and service available to people living with HIV. The Ministry of Health and Wellness endorses this timely initiative. The Memorandum of Understanding between the Ministry and the University of the West Indies will see both parties pooling efforts and resources to increase efficiency and improve the service delivery to people living with HIV in Jamaica. This alliance and consistent HIV prevention will strengthen care and treatment service as Jamaica strives towards epidemic control. The ministry is committed to the tenets of the universal access to health care, which is physical accessibility, ensuring health services are in reasonable proximity and hours of operation feasible to those who need it. And we have been doing that, especially during this epidemic of COVID-19, which has been very challenging for us. Making sure that it's affordable and acceptable to persons utilizing the service. We want to definitely thank the United States Agency for International Development, USAID's President Emergency Funds for AIDS Relief, PEPFAR, and the University of the West Indies, MONA, for their technical and financial support for this partnership that will support the government's vision in universal access to care. Collaboration such as this will strengthen the national program and direct a unified response, pivoting Jamaica towards achieving epidemic control of HIV and other STI, STDs. Thank you so much.
Thank you very much, Minister Cuthbert-Flynn, for those words of that expression of commitment of the ministry. And it really, as you speak, it's about the partnership. And we thank you that the ministry is right there running with us. It's not so much a race in this context. I know the minister is very familiar with winning the race, and what we're hearing here is that she's committing the ministry to partnership. So we're all heading for the same finish line, the University of the West Indies, Ministry of Health, and Health Connect Jamaica as we move forward. Ladies and gentlemen, we'll now have the signing of the MOU between the University of the West Indies, Mona, and the Ministry of Health and Wellness, Jamaica, the MOU which governs the operations of Health Connect Jamaica. Principal Weber and Minister Cuthbert-Flynn will now do the honors.
That's it? Okay. Wonderful.
Okay, thank you very much for that. We now completed the signing ceremony. I'm now going to invite our principal, Professor Dale Weber, to bring the closing remarks. Principal Weber.
Thank you very much, Chairman. When one embarks on a journey, it is not always clear what the end destination will be. And this project, we would like to know what the end would be, but we're not sure the date. We're not sure the pace. And the minister knows better than many how you need to pace yourself throughout this exercise. Having now completed this MOU signing, we have not just gotten our marks, we've not just heard the gun to go, but we've actually made the first bend, and now we're on the backstretch. We are therefore going to redouble our efforts, take our sights on those who are ahead of us, and see how we can achieve those goals that you spoke to, Minister, which are very important for national and regional development. Not only is it important for the ministry, who has a responsibility to the country and the people in the country, but to the university, which also has that responsibility in this partnership, and the USAID, in being an aid organization within Jamaica operating, has facilitated and continues to facilitate us achieving our goals. This partnership has served us well, it will continue to serve us well, and as we go down the backstretch, we have our sights set on the next bend, where we will, using the data that we have, be able to report back to the media, to the people, the level of success that has been done. Because it is only by achieving the goals and sharing the information that all will understand that the partnership has been successful. I would like to thank the Minister for having taken the time to come in and sign this morning. For us, it is very important because it means we have the maximum, both on the track and off the track, in terms of pushing us towards that goal. The Permanent Secretary, who has been chairing and leading the issues and the discussions as Health Connect Jamaica got itself formed and got itself up and running. Thank you very much, Minister Brian. I'm speaking it into the future. I'm speaking it into the future. To our director for USAID, our country director, for having seen the light in terms of what this project could do for bringing PEPFAR to the university as a partnership and continuing to work with us on this and many other projects. And to the Faculty of Medical Sciences, and especially Dr. Barrow, who has worked magic, literally, to get us to where we are and continues to do that. I'm just asking Dean Paul to continue giving him the leverage to work the magic that he can. Most importantly, I'd like to thank you all for having shared with us this morning, because you are the manifestation of what we're trying to do. And having taken this to the wider public, you will share the information so that Jamaica will know. And those who have HIV as an issue now know there's another way to get this done. There's another mechanism, there's an avenue without stigma which can get you to your goal. So we will all get down that backstretch, around the end and to the tape. Thank you very much for sharing with us this morning, and I look forward to sharing with you, perhaps in another 6 months or a year, the great successes that this project has yielded. Thank you very much and good morning.